All right, good morning, good afternoon, good evening, depending on where you are, everyone. Thanks for joining today's webinar. I'm very happy to let you know that this is the first webinar of our new webinar series here at Results Canada. So we're very excited to have you here, whether you're listening live or listening to the recording. A few housekeeping before we get started. So just so you know, as I've just mentioned, this webinar will be recorded because there were quite a few people who were interested in listening in, but unfortunately the timing was not working for their schedule. The webinar should be approximately 45 minutes, but just to be safe, we have booked an hour, but we'll try to keep it to that. Everyone should be able to unmute themselves. The webinar is really meant to be a discussion rather than just a presentation, so feel free, and we're actually really hoping to hear some of your questions. So you could either unmute yourself. There is also a chat box, so at any time if you have any question or if there's anything, if the sound's not good, please let us know. Don't hesitate to do that. And I think you can also raise your hand. So whichever way you prefer. So just so that you know who you're speaking with today. So my name is Melissa. I am the public engagement organizer here at Results Canada. I joined the team about 2 months ago. And I have my colleague next to me.
Hi, I'm Shelley Garnham. I am the tuberculosis officer at Results Canada. So we do advocacy and policy for Results Canada.
Great, thank you. So we're happy to be your two co-hosts today, and we will start off by setting the stage a little bit before we hear from Ingrid, who we're really here for, is we really are keen to hear from Ingrid. So just about Results Canada, in case you're not familiar with our organization. So we are a movement of passionate citizens, and we are strongly committed to raising our voices for a world without poverty. So we are a national grassroots advocacy organization, and we've been around for more than 30 years, and we are unique at what we do and how we do it. So basically, we work closely with national and international partners on issues dear to us and Canadians. We're a group of volunteers and staff working together as advocates, and we aim at having an impact on the world through different actions, such as having events on Parliament Hill, writing media pieces, meeting with federal members of parliament, and many other things. So what I really want to emphasize on is that Results has two main core activities. So one of our most important thing is that we strongly believe that individuals have voices. So we definitely focus on that. And our other fold as well is that we work on creating political will to end poverty, as I've mentioned. So what we do is we combine the voices of our grassroots advocates with strategic advocacy efforts to leverage millions of dollars for programs and improve policies that give the world's poorest people the health, education, and opportunity they need to thrive. So we work on campaigns such as education, vaccines, and immunization, nutrition, and amongst others. So today we have the opportunity to do a deep dive on tuberculosis, or TB, specifically one of the very important campaigns that we work on. So the idea really today is to have the discussion so that we can explore and understand further the topic of tuberculosis and see how we can together have an impact on this infectious disease. So without further ado, I'm happy to pass it over to Shelley, our TB advocacy officer, who will give us a brief overview of the work we do and will also introduce our guest speaker, Ingrid. We just need to pass over the mic.
Sorry, to avoid some echo on your end, we're going to share a mic here. So, okay, hi. Thank you for everyone joining. As I said, I'm Shelley Garnham. I'm the Policy and Advocacy Officer, and my file is tuberculosis. Tuberculosis is generally a neglected disease globally and in Canada as well. And so we work to advocate for greater attention, funding, and policy to end tuberculosis around the world. Just a little bit of a background on tuberculosis, and from here on I'm just going to call it TB because it's a bit of a mouthful. As it says on the slides there, treatment and care and research and development are under-resourced around the world. it not only does tuberculosis lack some science and innovation and some serious issues in care and treatment, but it also really comes down to lacking political will. It doesn't have the attention that it needs from our major political leaders that then essentially trickles down into patient care, patient treatment, and patient rights. So this lack of political attention has caused TB to now be the world's top infectious killer. It claims more lives than HIV and malaria combined. It has resistant strains to treatment that we'll speak about a little bit later. And it's airborne, so it travels through the air. It causes an infection primarily in the lungs, but it can infect any part of the body. So people can have it in their spleen and in their brain and in their reproductive organs. And so it can cause serious damage to the body and also death. It's also been around for centuries, but it's curable. And I think that's something that we should really focus on, that there is a cure. We'll skip to the next slide there. So on that sort of bright side that there is a cure, TB, why now? Well, World TB Day is coming up. It's on March 24th. The theme for this year is Leaders for a TB-free World. And so that's, again, touching back on that like major global political attention that we're looking for. So on March 24th every year, TB activists and advocates and patients and the whole community come together to stand in solidarity with one another, and especially with patients and communities who are suffering from TB, to say that we are going to continue the fight, we are going to end this together. And what we're looking for this year is major political leadership to make that happen. For an example of what the sort of global spectrum is in the world, we'll take a look at India right now. India has the highest number of TB cases and deaths in the world. It has a huge burden of tuberculosis. But just recently, actually days ago, the president of India in a global TB summit in Delhi sat down with experts and advocates from around the world, and in particular within India, to make a commitment to end TB by 2025. The global goal to end TB is 2030. So this is a really significant political commitment that the president of India has made. That's the head of state, that's the highest level we can get. And he said, you know what, 2030 isn't enough. People are dying. We need to address this by 2025. So if they're successful, this could mean a decrease in 1/3 of global deaths to TB. So India houses 1/3 of the deaths right now. So this is a really big statement. And we're hoping this will help to spur on other leadership in global TB progress. I think I'm going to speak a little bit more to that, but I think I'll wait and let Ingrid go a little bit about that, because she has been doing a lot of global leadership on some of the progress happening this year and some of the major events coming up. So I'm going to pause that. And just to introduce Ingrid a little bit, TB is also a major issue in South Africa. South Africa is one of the highest burden countries in the world. It has high rates of drug-resistant tuberculosis. It has really high rates of tuberculosis and HIV. Often, since HIV is a disease that affects your immune system, you are very susceptible often to diseases like tuberculosis. And so often they come paired in what we call the deadly duo. And so South Africa in particular has some of the highest rates of the deadly duo together. Most people who have HIV, if they die, they often die actually of tuberculosis infection. So it's a quite serious disease, particularly for those populations. South Africa also has made some significant advances in their global leadership, and they have some global leaders who have been working tirelessly to make changes globally and then domestically, nationally, regionally within their own country. And so with that, I think I'll pass it over to our keynote speaker today, Ingrid Schoeman, who is just an amazing, impassioned human being and advocate. I was lucky enough to meet her along with some other tuberculosis survivors and advocates last year, doing some training on advocacy, and have met her subsequent times since. And she is not only an amazing human being who has been through some very incredible, challenging pieces to her life, but come through the other side and is a very powerful advocate globally and within her own region. And so I think, Ingrid, I will pass the baton off to you and you can tell us a little bit about yourself.
Thanks, Shelley. Hello, everyone. Thank you to Results for inviting me to present today about how TB changed my life. I look forward to the discussion afterward. In 2012, I was in a coma, and my family was told to say their final goodbyes to me. My name is Ingrid, and I'm a dietitian from South Africa. I was working in a public hospital. I really loved my job, and then I got sick with pre-XDR TB. I was admitted to the hospital for chest pain, fever, and a rapid pulse. The physician thought it was pneumonia, but then after they did a lung biopsy, it revealed that I had pre-XDR TB. It was the TB medication that I took to save my life that nearly killed me. The medication to treat drug-resistant TB is extremely toxic. I developed liver failure and I was in hospital for 75 days, 1 month of which I was in ICU. So the photo on your left was taken while I was in ICU just after I woke up from the coma a few days after that. In hospital, my hair fell out. I experienced a lot of physical pain. There were tubes stuck up my nose, in my chest, and in my stomach. I was getting painful injections, part of the TB treatment, every second day, and I developed an abscess at the injection site. I struggled with nausea, vomiting, and diarrhea. It was hard losing my freedom, being in isolation, and being bedridden. But I'm glad God saved my life. The photo that you see there was of the medication that I was taking for the 2 years. It was really hard to take it. I realized if I felt like giving up despite having a lot of support from family and friends, they were really good and kind and loving to me, but it made me think how difficult must it be for the majority of people with TB who don't even have food on the table to eat. The photo on your right is at one of the union conferences, and I joined TB Proof and I support the Unmask Stigma campaign to raise awareness about TB and people who have TB or had it in the past, so that the public can see behind the masks, we are all the same, we all have hopes and dreams, that people should rather see the person behind the mask. Patients are already suffering and stigma makes it so much harder. So each year on World TB Day, we ask the public to take a selfie or a photo with a mask to show solidarity with patients with TB. I realized the value of kindness in hospital, and I think anyone who's been through something would have a greater appreciation for kindness than they had before. The pharmacist would draw pictures on my medication each month, and it made me look forward to getting my brown bag of pills because it came with a different story each time. The nurses became my friends, making life easier. The physician would some days just sit with me without saying anything, and that was also a comfort to me. Even if I was crying, he would just patiently wait until I finish and just take a minute or two to show that they care about me. And some nurses even brought oats flavored soap, which smelled really nice. I don't know if they did that because I was smelling like hospital soap, but I just remember that day when she showed it to me in the hospital, and she said she brought it especially for me. It really, it seems like a small thing, I'm sure, but it really touched me. After completing treatment, I joined TB Proof, a supportive community of health workers and people affected by TB. So it was nice to be part of a group of people who went through similar experiences. I now understand as a health worker and as a patient how difficult it is for people to complete TB treatment. as it can have devastating side effects. Like a friend of mine always says, if the medication was easy to take, everyone would just be taking it. We wouldn't have problems. A friend of mine, she's also in TB proof, an XDR TB survivor, Pumeza Tesile. She is deaf because of the injections she received to treat her TB. New drugs are available, yet MSF estimates that less than 5% of eligible patients were given access to these drugs in 2016. Each person has a human right to health, and people are worth investing in. So we want novel drugs available to all people who need them. So I also want to use this opportunity to ask you to sign on to support the My Patient's Choice pledge on that slide, asking that clinicians commit to informing patients about the newer treatment options and to explain side effects of treatment so that a patient can make an informed decision. 50% of patients on the injectable drugs used to treat drug-resistant TB suffer hearing loss. Now, if we just take a second to think about the loss that you suffer, just imagine the personal and social effects changing your quality of life, and also major financial implications if one would need cochlear implants. Ethically, we support human rights to science, and in the past, other medications or other options were not available. But now, is it justifiable to use all the drugs? I'm sure if we can choose, or let me not say I'm sure, if I can choose, I would want access to the newer drugs and not take a risk of losing my hearing. So why aren't patients being given the same opportunity? TB program managers can prevent a patient from suffering adverse effects, and they should use their political power to do so. I'm very passionate about this slide because really we need to treat a person and not just a disease. TB treatment is more than medication. We need health systems that are person-centered, addressing other important issues like nutrition. Working as a dietitian, we often saw malnourished patients with TB, and it was very difficult to get a patient in the first place to eat because of the side effects, let alone to maintain or gain weight. Then other issues include psychological support, diabetes, HIV, transport issues to get access to their medication. Now, I remember feeling so overwhelmed, and I'm sure there are other patients who also need social support. I was diagnosed properly and received good medical care. The WHO estimates that there are 4.1 million people around the world with TB who are not being reached by the health system. And therefore, we need TB champions in each local context to get people with undiagnosed TB to get tested and started on TB treatment if we want to end TB transmission in our communities. Therefore, community health workers have an important role to move undiagnosed people with TB to points of care where they can access TB treatment. Like Shelley said, because TB spreads through the air to our communities, households, and friends, we all must work together to end it. Now, I'm from South Africa, and I am proud to say our Minister of Health, Dr. Aaron Motsoaledi, is a true TB champion. He recently released a video working with faith-based organizations, and the video was released on YouTube where he was talking about TB openly. It's important for TB messages to be communicated in a community's local language to also ensure that people are understanding the messages going out. The upcoming UN high-level meeting on TB in 2018 is an urgently needed opportunity to change the picture of TB in each country, which is very exciting. But change can only be possible with political commitment to provide person-centered, high-quality TB services and safer medication. And just to conclude, we hope that civil society will participate in sharing the high-level meeting updates with their own networks, and also by giving their opinions. It's very valuable for all of us to build relationship and to hear each other's thoughts so that our messages can be inclusive of the wider general public. Thank you so much for your time and for listening to my story. And I'm not very shy, so you can ask me anything or most things. Thank you, Shelley.
Thank you so much. That was an excellent presentation. And every time I hear you speak, it still kind of brings me a little bit of chills on what you've gone through and how you've come through it on the other side. So thank you, thank you, thank you, thank you. I hope that everybody else got the same chills as I did and got a little bit excited too about the momentum that we are gathering. I don't think that we need to live in a world where people like Ingrid need to go through what she went through anymore. I think it's just crazy that people die of TB. And so I think we need to get excited about what we can do to help make changes. And that happens at Ingrid's level and the advocacy she's doing, and it happens at our level in Canada and the advocacy we can do. And I think we can all take action to make a difference. So thank you, Ingrid, for that. And I'm wondering if anybody has any questions to kick off the discussion. So I think you can raise your hand. You can unmute yourself.
Everyone is unmuted.
Perfect. And if we start to get some feedback, I think we'll just start to mute people again. So you're all unmuted. So if anyone wanted to just pipe in and ask a question of myself or of Ingrid or Melissa, please do. I thought I could hear someone, but perhaps it's background noise.
I have an excellent question. I hope to know the answer someday as well.
I can hear someone talking. I think they have a question, but I can't hear loudly enough. Maybe not. Oh, Chitra has a question. Chitra, go ahead.
Hi. Thanks for a very, very moving talk. And my question is, for you personally, what would you like, this is a question to Ingrid, sorry. For you personally, Ingrid, what would you like to see come out of the high-level meeting in September?
Great question.
Yes. The key advocacy asks are all important, but personally, after having to take the treatment, I would like to see funding for research and development for better TB treatment, safer medication, easier to take, shorter duration as well.
Great, thank you.
I think we want to see that too, and I think that's a good point, and also something that Canada and Results Canada and our advocates here can start to push for. And we've done a little bit of work on it in the past, and we've been talking about it with our members of parliament and members of government. But I think in the way that I have been involved so far in the process of the high-level meeting, it takes a long time for things to get secure because it is a high-level meeting, and there's a lot of, essentially red tape to get through to make sure things happen the way we want them. But Ingrid is a member of the Affected Communities and Civil Societies panel that has a very key role in inputting civil society and affected communities' priorities to the outputs of the high-level meeting. So in general, the high-level meeting will come out with a declaration that 193 countries sign on to, and it's basically an agreement on what they're going to do to take forward to end TB. And Ingrid has a very important role in representing affected communities and civil society to ensure that things like money for R&D for better TB treatment are included in that declaration. It turns into a really difficult negotiation process, but I'm very confident with someone like Ingrid at the helm, along with 14 other representatives from around the world who can bring those pieces forward and represent to ensure that the most important people in this fight, the patients and communities, are included in it and in the declaration. So
We have more information on the high-level meeting available with the Results Canada website, and also through ICAD, which is the Interagency Coalition on AIDS and Development. We've been partnering with them to do some awareness raising and webinars. And at the end of this call, actually, we can do some call to action and communicate a little bit clearer what some of those activities might be. But I see that Claire has her hand raised. So Claire, why don't you go ahead and ask a question?
Sure. Thank you for the presentation. It was great. So Ingrid, during your time that you struggled with TB, one of the things that you struggled with the most was the mental health element of the TB treatment. And I was just wondering what your favorite strategies are to reduce the stigma. The stigma of TB within communities.
I think one of the positive things, I'm really glad I did get TB, if I can answer it from that side, because it's opened up new friendships with different socioeconomic or racial or any other groups. There's something that happens once you tell someone I had TB, because a lot of people in South Africa would say, oh, my family member or a child, they also have seen that. But that's why one of our strategies within TB Proof is to openly share at any opportunity that we get, whether it's with the media or at meetings, that, oh, I had TB, and then you start a discussion. And also with our friends, with my family and friends, some of them tell me that they didn't know TB spreads through the air, or that anyone can get it. They had an idea that it's only, well, a certain key population that can get it. So I think it seems simple, but something like starting a discussion and just saying I had this has really helped with stigma for our organization.
Great, thank you.
I was just wondering, from your side, are you working with policy or also civil society? Maybe if you have suggestions how you guys do stigma reduction, you can also share that with us.
I like that question a lot. I have answers on that, but I'm curious if anyone else on the call, because I know we have people that some have been advocating for eradication of TB for a while. So I'm wondering if anyone else wants to jump in on that, or if anyone has experience with TB advocacy and TB patients in Canada. And it's okay if you don't. Or the UK. Oh, right, we have the UK too. Okay, I'm going to jump in. I think that stigma, particularly in Canada, is probably just as strong as it is in the rest of the world. In some of the communities and with some of the patients that I've spoken to in Canada. For example, there was a woman from Toronto. Toronto has some of the highest rates in Canada. She had contracted multi-drug resistant TB and went through treatment here and went through months of not telling her landlord that she had tuberculosis because her roommate was worried that they would get kicked out of their house. And I have heard of people who have been kicked out, and I've heard of people who have lost their jobs. It's particularly relatively more common for people who work in childcare, and often people who work in childcare work in the home. And so they not only lose their jobs, but they also lose their home. And that is examples in Canada. It also, TB is quite prevalent in Canadian Inuit communities, and I've spoken to some members of those communities who, part of it is stigma, and a lot of it too is education. I mean, they will go undiagnosed because the healthcare centers don't know how to, or that they should be diagnosing tuberculosis, and they don't know the signs well enough. And they also, within the community, they don't know, they are fearful of the disease, and so they become fearful of the person, and so the person can already feel quite isolated. And I'm sure, Ingrid, you can speak to that too, but there is a certain point in your TB care and TB treatment, and it's not very long, where you're under treatment, but you're still, you can still transmit tuberculosis. And it varies, but it's actually a lot shorter than people think. But people are nonetheless very fearful and so don't understand enough about the disease itself. And there's not enough community and social support for people in Canada as well, where we have very good healthcare systems. And so they don't have the community support they need, and it can be very, very, not just isolating, but depression is something that I hear from a lot of patients suffering from TB. Not just the medication, but literally the isolation alone can be incredibly stigmatizing. I don't know if you have any other thoughts on that, Ingrid, and apologies if I overstepped.
No, I agree with you.
Okay, perfect. Does anyone else have any other questions? Is anyone curious about any of the activities that we're undertaking on World TB Day? Or does anyone have any ideas, or are they looking forward to something they're doing, wanted to share, and or questions about the high-level meeting on TB? That's a pretty big topic. It can be quite confusing, but this is a great opportunity if anyone had any questions about that to dive a little bit deeper. Everyone is very well versed. Oh, go ahead.
I'd be interested in hearing in what you're doing for World TB Day.
Great. How about I toss that one to Ingrid first, because she was just telling us about some of her plans for World TB Day, and I think that maybe we can bounce off of hers. Ingrid, can I put you on the spot?
Yeah, sure. TB Proof, we've got a large base of volunteers. So some are speaking on the television or on the radio, or getting help to publish an article. But our main drive is the Unmask Stigma campaign, where we like to take the photos and share it on social media, and also go to key population groups to run the campaign there. And people like it. Yeah, they like putting the mask on, and it's an activity. So it's not just a presentation, which I think people enjoy. And then also we are very grateful that we have other opportunities. I'm getting to go to Australia next, or for just after World TB Day, to also participate in higher level meetings there. And I must say, it's incredible to see how there is momentum. Like Shelley said earlier, civil society is being included. There's definitely a move from my perspective, that research, studies, important meetings, they are including civil society more.
That's really exciting, and forgive me because I forgot about your Unmask Stigma campaign, and when we were preparing some of our concepts and ideas for our World TB Day events, it didn't occur to me to include that, but I would encourage anyone on the line who might be participating in World TB Day events, if you wanted to, I think that's a really cheap and easy and interesting way to get involved. So if you're going to go out and maybe take a photo at a monument that's being lit up in red, or you're doing any other events, or meeting up with people on World TB Day, or participating in the social media component, definitely grab a mask. I think that's a powerful image to have as well, especially if there's a group of you, to be wearing a mask. And I imagine they're probably pretty cheap and easy to procure, especially if you know someone who works in a hospital or a health community. And that's a really powerful way to say that you are with the community of people affected by TB. It's a powerful message, I think, to people that view it. So I would encourage that. I'm going to see if we can snag some as well. I think that leads nicely into going into some of our take action components. So if no one else has any immediate questions right now, wait, does someone?
This is Melissa. I just wanted to actually take the opportunity to just give a shout out to everyone who's been working hard actually since probably late 2017 on making activities happen for World TB Day. So I just wanted to give a shout out to, as an example, I know we have people from Calgary on the call, and they have organized activities. They're working with local public health, with the local TB clinic, if I'm not mistaken, in reaching out and trying to raise as much awareness as possible and reach as many people as possible so that people understand the importance of taking action for World TB Day and for the upcoming HLM. So there are activities happening in Calgary. People have been meeting with their MPs to advocate about the importance of the Canadian government to be present at the HLM. So I'm thinking in Toronto, and I know in Amos as well, Amos Northern of Quebec, they're doing activities in Montreal. So it's definitely been very exciting to see everything that's happening. I know at the University of Ottawa as well, there are plans to do some activities. So I just wanted to take the opportunity to give a shout out. And if we've mentioned one of your community or city and you're curious to know how you can be involved, please let us know. And if you haven't heard your city or your community, there's also still time to do something. So Shelley will go next into examples of how you can be involved. So I definitely urge everyone and all of us to not only get involved, but also to get friends and family and colleagues to take a photo, to do whatever you can. It's accessible to each one of us to use our voice to strongly encourage political will.
Well said. I agree. Thank you to everybody, and thank you to your continued effort on it. So yeah, as we said before, and Ingrid went over, the theme is wanted leaders for a TB-free world. Can we go to the next one so that I remember? Okay, perfect. And so yeah, take action. I think that's what results really is all about, is we are citizen advocates that take action on things that we are passionate about. And I am passionate about ending tuberculosis. So I'm pretty excited about this year's campaign. We have a couple of things going on, but the big piece is the Turn the World Red campaign. And so like Melissa said, we have some monuments and landmarks across Canada that will be lit up in red. Some of those were from Results Canada volunteers submitting applications to have them lit up, and some of them were from partners in community health organizations and other groups that have asked them to be lit up. So you can actually have a look at the Stop TB Partnership website. It's stoptb.org, stoptb.org. And they have a World TB Day campaign link that you can go to, and it just is a map of the world of activities that are happening. So it will include places that are going to be lit in red. It'll be other events, if there's photo opportunities, or if there's speakers or panelists or whatever is happening for World TB Day. Those events will be on that. So anyone around the world, I encourage you to have a look at that. And I'll be updating Canada's to make sure that we have our events on there as well. So we encourage you on March 24th, so that's not this Saturday, but next Saturday, to have a look, make sure that you have a landmark in red, head out and take a picture of it. If you have a sign, there's some resources you can print online that say NTB, or they have other resources and signs that you might be able to print out and hold up, so it makes it clear why you're standing in front of a red monument. I think that's one of the fun parts and challenges about this kind of pieces, that you have to actually tell people why it's red. If it's just red in the air, no one knows, then we've kind of lost an opportunity. But if you tweet it out and using the hashtag NTB, World TB Day 2018, you can also use that, send a direct message to your member of parliament, or you could send a direct message to, say, the Prime Minister of Canada, saying, I'm here to end TB. What are you going to do? Will you show up at the high-level meeting in September 2018? Or can't wait to see Canadian leadership at the September 2018 high-level meeting on tuberculosis? So there's lots of kind of options, and we have some resources if people want to know more about that. And there's also getting to know your member of parliament. And if you have a good relationship with them already, it's a great opportunity to have them also participate in the campaign. So Saturday, most parliamentarians will be in their constituency. And so when they're in their constituency, they're there for you. So if you invite them, and this is a thing that you are passionate about, your constituents, and you voted them in, and they are usually pretty good about doing things that their constituents want. So I would really encourage them to also participate. This is about eradicating TB globally, and Canada is part of the globe. So I think that's there's some really good arguments to have them participate, and it's pretty easy. They don't have to go down to the monument. If you can see the monument from their home or their office, they can snap a picture of it and tweet it out. And that also has some really big impact as well. They have lots of followers and it demonstrates Canadian support. So that can be very impactful. Some of you are very well-versed in writing letters to the editor or op-eds. We also encourage you to do that. And especially if this is your first time, there's actually a really great, what we call a hook. So letters to the editor, editors of newspapers are looking for a hook. They're looking for a reason why whatever you're writing about is worthy of publishing. And I think our hook right now, not only is it World TB Day coming up, but there's also this India announcement that India is going to end TB in 2025. That is the kind of political leadership we're looking for. So if you're looking for a hook, there's definitely something in there. On looking at India's leadership, Canadian relations with India are really good. If India eliminates TB, think of the impact that could have globally. We're looking for Canada to take that kind of leadership. So there's pieces in there, and you can always reach out to Results Canada if you're looking for a little more help or information or advice on writing a letter to the editor or an op-ed. And then finally, I will give a shout out to a webinar that we are hosting, and this will be after World TB Day. But like we said, World TB Day is the kickoff for this campaign. We're looking for leaders for a TB-free world, and that doesn't happen in one day. And so this arc of this campaign is in lead up to the high-level meeting on tuberculosis. That high-level meeting is happening on September 26th, 2018. We want to ensure that heads of state attend that high-level meeting and that we have the decisions that are patient-friendly and patient-centered care and will match with resources and research and development to help really move the needle on ending tuberculosis. So we have a webinar series in partnership with ICAD, the Interagency Coalition on AIDS and Development. This specific one will be on gender and the high-level meeting. So we're looking at how gender affects TB, rates of TB in pregnant women, for example, or how cultural identity of gender affects TB care and treatment. That's on April 26th from 1 to 2 p.m. We will be sharing the invitation to that shortly, but I would have a look at the Results Canada website. You can email me directly, or if you go to the ICAD website, it's on there as well. They have really great resources of up-to-date information on the high-level meeting. So I think I will put a pin on it there. It's gone on certainly long enough. Oh, I wanted to throw it, sorry, one more time to Ingrid's pledge. Perfect. It's in the chat box. There's a link to the TB Proof patient. It's the TB Proof patient pledge, right, Ingrid? Sorry, I'm going to say it wrong. Can you give one last pitch for your pledge?
It's called the My Patient's Choice Pledge. So it's a person treating someone who has TB, giving them good counseling and a choice. What do they want to take? Perfect.
So if anyone is looking to take action, say right now, you could very easily click on that link and demonstrate your support for that pledge and your support for patients getting the care that they deserve, not just the care isn't the right word. Anyway, not just the treatment that might be the easiest or what someone knows about, but really working forward to ensure that patients get the best care available. So thank you very much, and I'll pass it over to Melissa.
Thank you, Shelley, Ingrid, and everyone else for your questions. So we're just wrapping up now the webinar. So we hope that you found it interesting and that you're all pumped up and ready to take action now. So we wanted to share this last slide in case, as a reminder, if you needed any support or if you had any further questions, please reach out to us. As mentioned, this webinar has been recorded, so we will also be sharing it along with the slides. So please stay tuned to get more of those details. And we also, of course, wanted to mention that we are having our national conference in Ottawa from May 5th to May 7th. So if you're really keen about learning on how to be an advocate and how you can have an impact from the grassroots to the global movement, please consider coming. Ottawa is nice in May. I think the tulips will be out or close to, so it's a good opportunity for you to take a short vacation as well if you're not in the Ottawa area. We do have more information on our website, but we already have great speakers lined up, such as Stephen Lewis, And I'm blanking on the other names right now. Shelley, do you remember? I didn't.
Yeah, we have Carol Narenda from Sitsan Plus, which is an organization in Zambia in West Africa. We have, now I'm blanking on names.
Sorry.
Sven Robinson will be speaking on our parliamentary panel. We have actually a few of our grassroots citizen advocates who will be doing some presentations and workshops. It's a really fun, really engaging, interactive conference. So I'm pretty excited about it. And we'll also have a TB workshop in there that'll be really fun. We have a woman coming in who works for Stop TB Partnership Kenya, and she is an amazing advocate. So pretty excited about that.
Thank you, Shelley. Sorry for putting you on the spot. And the speakers are listed on our website, so results-resultat.ca for more information. And by all means, send us an email. And last but not least, thank you very much. And we hope you have a great rest of your day and have a good weekend. And we look forward to seeing your actions online and everywhere else. Thank you, everyone.
Thanks, Ingrid.
Bye-bye.
Bye, everybody.
Bye-bye.
Bye-bye.